They're not able to concentrate on their health as a whole because they're trying to concentrate on survival. How am I going to eat? How am I going to even go to work every day?
Community health centers are vital because they are able to provide services to patients where they are in the areas of transportation, other support, health education, outreach to get folks into clinic to be able to access the services. All of those things are unique to community health centers.
So care coordination is where we assist the patients with meeting their social determinants of health. So we basically help resolve any issues that they may have that could be hindering them from coming to their doctor's appointments.
We help with so many resources, like when it comes to housing, when it comes to the food pantries, when it comes to utility bill payment, when it comes to clothing, emergency Pampers, diapers, wipes, emergency milk.
Typically, they're very excited to feel like somebody cares about what their needs are and helping them. It's not just like, oh, you just want me to get an appointment. It's like, okay, you actually care about what happens after my appointment.
One of the moments that I had was with a patient. It was a mom. Her son was the patient. She had a DV situation, and her kids was put in a shelter, and she needed some assistance with get housing. So that's why I came in, took the load off her back with that. So I ended up connecting with a housing rep that we have, and then another resources, which is the furniture bank. And all of us together, she ended up getting her house.
I've been homeless ever since I was 14. I left out of my mother's house because I didn't want to abide by her rules. When I had my first daughter at 21, I've been looking for my own place, you know. I always saved up money to try to get an apartment, but I didn't meet certain credentials that these apartment buildings or places was looking for. My experience with Chicago Family Health Center is the most blessed thing that I ever had in life. This is the epitome of not wanting to go back to your old ways, because you actually have somebody that's willing to help you, that's telling you you deserve to be helped. You know, instead of people always telling you, no, you don't deserve this because you passed. You don't know me, you just know what people tell you. So as long as you tell me no, or as long as you look at me like that, how do you expect me to act? So by you giving me a chance, and you all giving me a chance, that makes me better as a man.
So a person isn't just one illness or one disease or one problem that they come in with. So we have different problems and they need to be addressed, and Chicago Family does that. So we have dental programs, we have dentists and hygienists that can provide a wide range of procedures, maintenance, cleanings, things like that. We have a robust mental health, behavioral health program. We can typically get them in within the week. If they come to me and they say, I need somebody to talk to, we have that for them.
One of the main programs that I oversee is our Lunch and Learn, in which we have a provider from Chicago Family talk about a specific topic that we survey patients that deal directly with our care gaps at Chicago Family. We're speaking about hypertension, we're talking about diabetes, we are speaking about mental health, we are speaking about nutritional needs that directly relate to those care gaps as well.
Well, when I got the email, when it talked about mental health, and I know that that's a prevalent subject in this day and time, and it could affect us as an individual, it could affect us as a family, friends, and when you connect with there's a reality to this here, it's not just a myth, then you seek help.
integrated primary care behavioral health program is the cutting edge HRSA sanctioned best practice model for delivering behavioral health services. So our behavioral health providers, which are licensed clinical social workers and licensed clinical counselors, they are embedded in every one of our health centers, every one of our 6 centers, and they partner as part of the care team with the primary care providers.
You speak Spanish? That's usually the one. We're very lucky to have a lot of providers who speak Spanish there, but it's not site-wide, and so this is a very Spanish-speaking prevalent community. It's amazing. They feel comfortable telling you everything that they need to get out. So we did have a patient come in, young male come in, was just looking for just a wellness exam. Unfortunately, in one of our annual wellnesses, we do include STI testing, and he had a not good diagnosis. And so I was able to get him behavioral health the same day. We were able to get him in contact with infectious diseases the same day. This was a very life-changing diagnosis, but it's not the end. It's only the beginning of him getting well. And so on our follow-up, when I called him back, he said, "Thank you." That's what he said.
The dental care program at Chicago Family Health Center provides preventive, basic restorative, and basic oral surgery care for patients of all ages, regardless of their financial status. Oral health is overall health. The communities that we serve are already at a higher risk for systemic issues such as heart disease, diabetes, and pregnancy and birth complications. And studies have shown that poor oral health is linked to those systemic issues. So our providers are asking questions about our oral health during medical visits. Our dentists and staff are taking blood pressure at every appointment, and our behavioral health providers are looking at oral health because when someone is diagnosed with depression or substance abuse, it can cause a great decline in their oral health. And that might be one of the early indicators. Chicago Family Health Center also offers a sliding scale program which allows uninsured patients to pay a discounted price based on their financial income. The donations that we receive are directly helping fund that program so that we're able to assist these patients in that smaller copay.
When me or my staff go out and we're advertising Chicago Family Health Center and we let them know about the sliding scale program, they're like, "What is that?" We're like, "It's a discount program. You know, you come in and pay $20 for your medical visit. That covers labs, your doctor visit," right? And they're like, "No way." So you get this excitement that you see the patient, that they could come to us for low cost. Me growing up, I always thought that we couldn't go right to the doctor because it was expensive, and if you couldn't pay for it, you couldn't see it. But now you come to Chicago Family Health Center, who's a federally qualified health center, and you have this program that helps you.
Neighborhood health clinics are important because you have a lot of patients that doesn't have access to go far places for care. It's convenient for the patients. It's also important to make sure that we have all the services for the patients in that community.
Your donations can help the Care Coordination Department service our patients better. It'll assist us with providing transportation services, helping paying for fees for furniture, for food, clothing, and whatever they need.
Your donation today will provide assistance to health education to further the program of Lunch and Learns for our patients at Chicago Family Health.
In addition to helping us provide resources and services to patients of Chicago Family, your support will also help us look for opportunities to expand. We are in locations where we have outgrown and are looking for new locations to build and be able to expand into other communities in the Chicagoland area. So your support is vital to the continued growth and development of the great work that we do in community.
I look at Chicago Family Health Center as family. The word family is in there. And by you guys donating and helping out a cause for not just our family, but for all our patients in our neighborhoods. Please donate, please. Thank you.